A vestibulo-ocular motor screen, abbreviated VOMS, is a tool used to gauge the involvement of both the vestibular and ocular systems after a concussion or episode of vertigo. There are 5 tests within a vestibulo-ocular motor screen: smooth pursuits, horizontal and vertical saccades, convergence, horizontal and vertical vestibulo-ocular reflex, and visual motion sensitivity. Patient symptoms are recorded before and after each test. This test is designed for patients within the age range of 9 to 40 years old. Make sure the patient is wearing corrective eyewear as needed before starting any tests. Any abnormal findings or provocation of symptoms may indicate a dysfunction within those systems and should result in a referral to appropriate health care. The first step is to record baseline symptoms on a scale of 0 to 10 with the patient before beginning any testing. The patient is to rate headache, dizziness, nausea, and fogginess as demonstrated on the chart shown. After baseline symptoms are recorded, we can start the first test. The first test is for smooth pursuits, which test the ability to follow a slowly moving target. The patient is seated with the examiner positioned in front of them. The examiner holds a fingertip 3 feet from the patient and then proceeds to move the target 1.5 feet to the right and 1.5 feet to the left of the midline. 1 repetition is complete when the target moves back and forth to the starting position. 2 repetitions are performed in this direction at a rate of 2 seconds from left to right and 2 seconds from right to left. This is repeated with the examiner's fingertip moving 1.5 feet above and 1.5 feet below the midline for 2 repetitions at the same speed. Record the patient's symptoms after completing this test as well. Saccades are the next step. Saccades test the ability of the eyes to move quickly between targets. The patient is seated. Starting with horizontal saccades, the examiner holds 2 fingertips or single targets horizontal at a distance of 3 feet from the patient and 1.5 feet to the right and 1.5 feet to the left of the midline, so the patient must gaze 30 degrees to each side. Instruct the patient to move their eyes as quickly as possible from point to point for 10 repetitions, where 1 repetition is back and forth into the starting position. Record their symptoms. The vertical saccade is the same test repeated with the targets 3 feet from the patient and 1.5 feet above and 1.5 feet below the midline, so the patient must gaze 30 degrees in each direction. Instruct the patient to move their eyes as quickly as possible from the target to target for 10 repetitions, with 1 repetition being up and down and back to the starting position. Record their symptoms. Convergence is our third test that measures the ability to view a near target without double vision. It requires a tongue depressor or target with size 14 font and a measuring tape. The patient is seated and the examiner is in a position to observe eye movement during the test. The patient focuses on a small target at arm's length and slowly moves the target towards the tip of their nose. Instruct the patient to stop when they see 2 distinct images or when there is an outward deviation of one eye observed. Blurring of the image is ignored. Measure and record the distance in centimeters between the target and the tip of the nose and repeat this test 3 times, recording each measurement. Record their symptoms after completing the test. An abnormal find for this test is a near point of convergence greater than or equal to 6 centimeters from the tip of the nose. Vestibulo-ocular reflex test, or VOR test, assesses the ability to stabilize vision as the head moves. This test requires the same tongue depressor or target with size 14 font as used in the previous test. The patient is seated and either the patient or examiner can hold the target at the midline at a distance of 3 feet from the patient. For horizontal VOR, the patient is asked to rotate their head horizontally with an amplitude of 20 degrees to each side while maintaining focus on the target. If a metronome is available, use it to ensure a speed or rotation is maintained at 180 beats per minute, 1 beat per direction. 10 repetitions are performed, with 1 repetition being back and forth and then back to the starting position. Record their symptoms. Repeat this test vertically with the patient moving their head at an amplitude of 20 degrees up and down from the midline and using a metronome as possible. Perform 10 repetitions and then record their symptoms. The last portion of the screen is the visual motion sensitivity, or VMS test. The VMS test assesses visual motion sensitivity and the ability to inhibit vestibular-induced eye movement using vision. The patient is standing with feet shoulder-width apart facing a busy area of the clinic. The examiner is positioned next to or slightly behind the patient to spot them without restricting their movement. The patient holds one or both arms outstretched and focuses on their thumb. While maintaining their focus on their thumb, they rotate as a unit with their head, eyes, and trunk at an amplitude of 80 degrees to the left and 80 degrees to the right. A metronome can be used, if available, to maintain a speed of rotation at 50 beats per minute, where 1 beat is each direction. 5 repetitions performed, where 1 repetition is trunk rotation to the right and left and back to the starting position. Record their symptoms. This is the conclusion to the vestibulo-ocular motor screen process. As stated before, any abnormal findings or provocation of symptoms indicates dysfunction within the vestibular or ocular systems and warrants a referral to appropriate healthcare professionals.